If you have renal issues, strange mental symptoms, or stomach discomfort, you may have too much vitamin D. In a blood test, too much vitamin D is also detected. An essential component of preserving health is vitamin D. It is essential for maintaining the health of your skeletal system, fostering the growth and development of your muscle cells, and ensuring that your innate and adaptive immune systems operate as intended, among other things. Many people utilize vitamin D tablets to maintain appropriate vitamin D levels, since vitamin D insufficiency is more common. However, excessive vitamin D can also cause negative health effects. What are the most typical adverse consequences of excessive vitamin D3 intake? The following are indicators of vitamin D intoxication. Increased blood concentrations. Vitamin D must be present in the body at concentrations more than 100 nanograms per milliliter ml to be poisonous or harmful. Blood vitamin D levels exceeding 100 nanograms per milliliter are considered excess, and serum levels exceeding 150 nanograms per milliliter are considered vitamin D intoxication or hypervitaminosis D. Though research indicates that levels between 30 and 60 nanograms per milliliter are probably appropriate and may help prevent illness and disease, recommendations regarding the ideal amounts of vitamin D differ. A healthy person's blood vitamin D levels are unlikely to approach dangerous or excessive levels, even with high-dose vitamin D tablets. Prescription errors and improper supplement doses are the main causes of vitamin D poisoning. A 73-year-old man, for instance, experienced vitamin D toxicity in a 2020 case report after consuming 10,000 international units of vitamin D daily for many years. A 56-year-old lady was sent to the hospital in 2020 after taking an average of 130,000 international units of vitamin D daily for 20 months in an attempt to alleviate her multiple sclerosis symptoms, which included muscle weakness, nausea, and vomiting. It was found that her vitamin D levels were 265 nanograms per milliliter, or 130,000 international units, more than 30 times the 4,000 international units daily safe upper limit that is often advised. Remember that to achieve and maintain healthy vitamin D levels, those who are low in the vitamin may need to take far higher quantities than the acceptable maximum limit. To find out what dosage you should take, though, be sure to speak with a healthcare provider. This will assist you in avoiding dosages that might be harmful or improper. Elevated blood calcium levels. Your body uses vitamin D to help absorb calcium from your diet. This is one of its most significant functions. Conversely, excessive vitamin D intake can raise blood calcium levels, which can result in uncomfortable and even harmful symptoms. Hypercalcemia, or abnormally elevated blood calcium levels, is the main sign of vitamin D poisoning. Hypercalcemia symptoms include weariness, dizziness, hallucinations, confusion, and digestive problems, including nausea, vomiting, constipation, and stomach pain. Appetite loss, excessive urination, kidney damage, kidney failure, kidney stones, elevated blood pressure, and irregular cardiac beats. Dehydration. Blood calcium levels typically vary between 8.5 and 10.8 milligrams per deciliter. People who take megadoses of vitamin D for an extended time usually develop hypercalcemia. According to research, persons with symptoms who take more than 10,000 IU of vitamin D per day should have their hypercalcemia assessed. The woman in the 2020 case report was hospitalized for hypercalcemia-related symptoms after taking an average of 130,000 international units of vitamin D daily for 20 months. These included kidney damage, muscle weakness, nausea, and vomiting. The calcium levels in her blood were 3.23 millimoles per liter, 12.9 milligrams per deciliter. Hypercalcemia needs to be treated right away because it might be fatal. Gastrointestinal symptoms. Excess blood calcium is linked to the primary adverse effects of high vitamin D levels. The following are some of the primary signs of hypercalcemia: nausea, throwing up, constipation, diarrhea, inadequate appetite. The symptoms of hypercalcemia vary from person to person, though. After taking a pill that turned out to contain 78 times more vitamin D than the label indicated, one woman reported experiencing nausea and weight loss. Crucially, these symptoms were brought on by too high vitamin D3 dosages, which raised calcium levels above 12 milligrams per deciliter. For instance, An 18-month-old child who received 50,000 international units of vitamin D3 for 3 months experienced diarrhea, stomachache, and other symptoms. After the youngster stopped taking the vitamins, these symptoms went away. Altered mental status. People with vitamin D poisoning may experience altered mental status as a result of hypercalcemia. People who have hypercalcemia brought on by vitamin D poisoning frequently experience symptoms like disorientation, depression, and psychosis. There have been reports of coma in severe cases. A 64-year-old man inadvertently consumed 200,000 international units of vitamin D daily due to misinterpreting the directions on his medicine, according to a case report from 2021. Along with other severe hypercalcemia-related symptoms, he displayed disturbed mental status. For the first 10 days of his hospital stay, he remained anxious and confused. But as his calcium levels decreased, his symptoms progressively improved. His calcium levels returned to normal after around 18 days. Kidney complications. Renal damage and even renal failure can occasionally be caused by vitamin D intoxication. This is because an excess of vitamin D in the body can result in elevated calcium levels, which can promote water loss through excessive urination and kidney calcification. Additionally, hypercalcemia can cause the kidney's blood arteries to narrow, which impairs kidney function. Moderate to severe renal damage has been documented in numerous investigations involving vitamin D intoxication. It's interesting to note that those with kidney illness may experience serious problems from a vitamin D shortage. This is one of the reasons it's so important to keep your blood levels of vitamin D at ideal levels. What leads to a lack of vitamin D? Toxicology is rare, and vitamin D doses are thought to be extremely safe. This is because reaching toxic or harmful levels in the body would require a healthy individual to take incredibly high doses of vitamin D over time. However, individuals with specific medical problems are more likely to have vitamin D poisoning. These consist of granulomatous conditions, birth defects. Vitamin D metabolism was dysregulated in certain lymphomas. Vitamin D poisoning is rare but can happen, particularly when there are prescription errors or unintentional overdoses. Abuse of vitamin D pills with high dosages. Other names for vitamin D toxicity include vitamin D poisoning and hypervitaminosis. D. Vitamin D supplement safety. People with extremely low vitamin D levels may be advised by medical practitioners to take very large weekly dosages of 50,000 international units for 8 weeks. Once their levels reach 30 nanograms per milliliter, they can then take a maintenance dose of 2,000 international units daily. Depending on your vitamin D levels and general health, your doctor will determine the best vitamin D dosage for you. Although vitamin D toxicity is uncommon, you could be in danger if you abuse injections, prescription vitamin D pills, or over-the-counter vitamin D supplements. Your doctor will check your vitamin D levels to make sure they aren't getting harmful if you're getting injections or taking very high doses of vitamin D supplements. Steer clear of high-dose vitamin D pills unless prescribed by your physician. If you take too much vitamin D, it can lead to toxicity, causing symptoms like nausea, weakness, and kidney damage. Always consult a healthcare professional before starting any supplements. For more health tips, like, subscribe, and comment below.